Welcome to this introduction to BTEC Health and Social Care Tech Award Level 1 and 2. So on screen now you can see just a few jobs within health and social care. It's a really broad sector which encompasses many jobs that you will already have heard of. You know, for example, a children's nurse, play worker, probation officer, social worker, midwife. There's many more as well. So what is health and social care? So within health and social care, we look at the three different sectors. So we've got healthcare, so it incorporates staying healthy and remaining without infection or disease. People who work in healthcare are normally looking after patients who have or may have a medical problem. So nurse, doctor, dentist, etc. We also have social care. So this describes activities, services and relationships that help people to be independent, active and healthy. So social worker obviously being one, care home worker, youth worker. And then we also have the early years sector, which includes education and support for children under the age of 5. So here we've got nursery workers, childminders, mums and tots groups, anything like that. So is health and social care the right subject for you? Well, within health and social care, it's quite, as I said, a broad subject. So we learn through investigation. You develop knowledge and understanding about health, social care and early years. You will complete assignments and practical work. You will learn about and understand the world in which we live in. Scarborough is a big area for health and social care. You know, we have an elderly population. We have a lot of people that are over the age of 65. There are lots of jobs within health and social care in Scarborough and obviously in the rest of the country. And we also research occupations you may want to work in. So the majority of people who take health and social care are thinking about working in that sector, but you don't have to. You know, you could want to be a hairdresser, for example, and you can still do health and social care. You don't have to want to work within the health and social care sector to do it, but you do need to have some sort of interest. So what you need to be able to do then is you need to be good at sticking to deadlines. A large proportion of this subject is coursework based, and I'll talk about that in a second. You will be given a deadline and you need to complete the work to stick to that deadline. You also need to research independently. Of course, we will do plenty of things in class, but there will be times when you need to go off and find information for yourself. And as I've already said, you do need to have some interest within health and social care, although it doesn't have to be the job that you want to do in the future. So this is what we're going to cover then over the 3 years. So in years 9 and 10, we'll do component 1, which is a coursework unit. So this component helps you to understand how people grow and develop, as well as personal relationships that people have. So we'll look at how people progress from birth right through to later adulthood. So from 0 right up until, 65 and over, could possibly be it to 100 and past that. And this will be a piece of controlled assessment. So this will be worth 30% of your course. We will probably start it towards the end of year 9 and you will continue it into year 10. You will have enough time to do it, but you must stick to deadlines. And then the rest of year 10 then we'll be working on component 2, which is also a coursework unit. So here we will practically study and explore health and social care services and how they meet the needs of the people. You will also look at care values. So these are things that a care worker has to follow. So for example, confidentiality would be one. So like I say, this is a piece of controlled assessment, and there's also a practical element. So we do an interaction with real people for this one if we can. And then in year 11, you will study component 3, which will be the exam unit, which is worth 40% of the course. So here you will study factors that affect health and well-being. Now, we will already have looked at this as well. We'll do a little bit of this in year 9, but you won't do the exam till year 11. So you'll learn about physiological disorders and lifestyle indicators. So for example, you'll look at height and weight. You'll look at maybe people with asthma, for example. You might look at the effects of smoking. You will also learn how to design a health and well-being improvement plan to include short and long-term targets. So say, for example, somebody wanted to give up smoking, what sort of things could we put in place to help that happen? Like I say, this looks at stuff that we have learnt in year 10 and year 9. You will do a 2-hour exam, which will be in Year 11 in the February, and then you get to do a resit in the May, and you are able to keep your best result. After the course, many students go on to continue with health and social care at the sixth form or at BTEC, and I also have quite a lot of students who undertake an apprenticeship within health and social care. So a quick recap there on the screen. So this is a BTEC Tech Award for Health and Social Care. 60% of the exam is coursework, so you do really need to understand that that is part of it. 40% is an exam. You need to be able to stick to deadlines and research independently. For further information, please contact Ms. Johnson. My email's there on the screen. I will get back to you as soon as I can, and I'm very happy to answer any questions you have. Thank you very much for listening.